Some people are afraid of having any surgery, but specifically hysterectomy, because maybe a family member had an open surgery and they were told that they were like in bed for 2 months or certainly not at work for a couple months. What was your experience?
Well, I will tell you that my mother had an open hysterectomy and was in bed for 2 months, and she actually had some complications with that. So it definitely did play into my decision to go this route, but my recovery was probably one of the most simple that I've ever been through, and I've had several surgeries. I've had 3 babies, so we all know how that goes, but this was a very simple surgery. I don't even think I felt enough pain not to be able to walk. I mean, I walked out of the hospital and I had to keep reminding myself that there was a lot being done on the inside of my body because the outside of my body was feeling great. So it's definitely an easy recovery. I was up and walking in 2 or 3 days. I don't know if I'm supposed to say that in front of my doctor, but it was a really easy recovery.
We'll let it go.
Yeah, really easy recovery.
And I think the robotic technology is, well, in my opinion, the best option. I think a lot of people end up in our practice and many practices going home the same day. Quick return to normal activities, driving, back to work. What was your experience?
So it was a very quick turnaround time for myself. I did walk out of the hospital. I was out same day. I was driving about maybe day 5, which I'm probably not supposed to do either, but I was driving and I was back to work in less than 2 weeks. I mean, I felt perfectly fine. I really just, like I said, had to remind myself that I actually had some major surgery that happened, but with the robotics, it's definitely just a game changer for people who are active and they need to get back to their lives quickly with no complications. I definitely 100%.
And you say you have to remind yourself. Is that because there wasn't a whole lot of pain or anything?
Right.
Or?
I just had, I really just, I don't think I maybe took Tylenol for a couple days.
Wow.
But that was it. There was no discomfort. I think the biggest discomfort I had, honestly, was maybe sitting up in the morning, just kind of getting your bearing, you know, maybe a little sore, like a hard ab exercise, you know, workout, something like that. But other than that, I mean, I felt fine. There was really no pain.
That's amazing. So we normally send people home with Motrin and Tylenol with codeine. You're a super healer, like so you're
I think. I don't know.
Above and beyond. So you know, individual results may vary, but that is a fairly good description of an average recovery. I think people go home the same day. They're driving probably 5 days, back at work in 2 days. There are a few things that take longer. I mean, you know, there's no sexual activity for 2 months, and you know, we had to lay off the hard ab workouts for probably 2 months. But other than that, I think what you're saying is what we hear from a lot of patients, and you know, that's why we see this value in robotics and why we've been so adamant about championing women to ask, to do the research, to find a provider that can give them the best possible outcome in the least invasive surgery.
I feel amazing now, and I wish that I had done it sooner. But I know that as a mom, and I'm sure there's a lot of moms out there that battle the same thing, that I can't take this much time, and it's really not that much time. Like, you're okay very quickly afterwards. So
a lot of people are going to ask, what is the scarring like? What are the incisions? Can you see them? Was there a lot of scarring? Do you notice it?
No, scarring is, so mine are gone. You can't see them anymore at all. I had one in my belly button, which I never saw in the first place, and then 3 others, and they're completely gone. So if you look at me, like my abdomen, there's no scarring whatsoever.
So that was a portion of my conversation with Michelle that I really wanted to highlight, because I don't think that we talk often enough about fears that people have around surgery and robotic hysterectomy. If you want to see more, please click on the full conversation in the video here. And if you have questions, please leave them in the comments section for myself or for Michelle. Be sure to subscribe for more great testimonials.